Okay.
So this just lifts up. I mean, it just
Okay,
moves.
okay, all right.
So that's the Velcro thing I was
Okay.
talking about. And then you just slide this thing through right under this. This is longer than, you have to fold it in a little.
Hello, everyone. I'd like to welcome you all today to First Presbyterian Church Champaign. My name is Brandy Lau. I think I know most of you, but I'm the current moderator for Presbyterian Women. It's really good to see you all here today. I'm not sure if this is correct, but I think maybe our last official gathering was Christmas tea, 2019. So this is really, really exciting. And it's great to see guests here today. It's really exciting when we have events that we can bring people in from outside of our church and from the community. I think that we have a lot of room to grow in that area in working together and doing good in our community through different faith organizations, and it's exciting to see that. This year has been quite different than past years. You've probably heard that in every single gathering that you've had recently, but it's very true. We usually start this off with a lunch and a time for socializing and just making connections with one another. And that's so important, and it's sad that we can't do that this year. But I want to thank the Faith Circle for putting together some goodie bags for all of you. So it's like when you're a little kid and you go to a birthday party, and at the end you get to take a goodie bag home. So you all can anxiously await to see what's in that goodie bag that the Faith Circle put together for you. I want to remind everybody that we need to keep our masks on the whole time. I see that everybody is wearing them so nicely above their noses. That's perfect. And you can enjoy your goodies outside or at some later time. If the weather's nice, cross our fingers, we might all be able to go outside and meet and socialize for a little while afterwards too. So as you can see by our banners, I love these banners. A mission in our church is to love God more, love people more, and love more people. So that's what we wanted this day to be about. Not only has the way we hold our gatherings and our church services changed, but the way that we interact with one another has changed too. And while we always want to make connections with people in our community, we don't always know what they need. And now things are more different than ever, and those needs are changing yet again. How can we love God more? How can we love people more? How can we love more people? These were our thoughts behind putting together today's program. We hope that it will help us to open our eyes to the changing needs of our community, and that it speaks to us in words that we might not have heard before. Proverbs 3:27 says, "Don't withhold good from someone who deserves it when it is in your power to do so." When we do have the ability and the opportunity to help somebody, it's important that we do so. We cannot solve all of the world's problems, but we can be a positive force in the lives that we encounter. Love God more. Love people more. Love more people. Let's pray together. Dear Lord, as we gather together here in this sacred place, we settle ourselves and still our minds. We look to be alive to all that is around us and within us. The Spirit is gently moving within each one of us. Help us to hear your voice calling to us, asking us to make a change or take a chance, showing us your way, showing us the needs of your people. Now is the time to reflect on who we are, how we are connected with each other, our communities, and the world around us, and how we are touched by the Spirit within us. Amen. Well, at this time, I'd like to bring up Sabrina Hu, and Sabrina is our current program director for PW, but she has filled many, many positions over the years, and we are so thankful for all that she has done. Sabrina.
Thank you, Brandy. And it's so nice to see everyone. And I hope everybody has a copy of the program. I'm honored here to introduce Julie Pryde. And in the back of your program, there's a detailed, her bio and all the wonderful things that she has done. But I just wanted to give a little bit of introduction here. So after a year and a half into the pandemic, this is the first time Presbyterian women are able to host an in-person gathering like we used to, but not exactly the same way. But as we gather here, we can't help but realize we're at a critical point of reflection and learning to make sure we continue to love and care for each other in a special way, in an effective way, and also especially care for those that have been working so hard to keep us as safe as possible. And one of those people is Miss Julie Pryde. She's a tireless leader who has been leading our community in fighting against COVID. As a result, all of us have witnessed how effective our community has been. In fact, 6 months ago, CU Public Health District was recognized at a national level for all their hard work, and Ms. Pryde was invited to speak at a White House event about the partnerships that CU PhD has formed to fight against COVID. Thank you, Julie, for making the time to speak with us and speak to us and share your insights. And we're so honored to have you here.
Thank you all for the invitation to be here today. I am honored to be with you all. I've done only a couple of things outside of the office since COVID happened, outside of the clinic, but the only time that I've spoken publicly has been at a pulpit in 2 Presbyterian churches. I don't know what that means. I don't know what it means, but I think it means that you are very attuned to what's going on, and I can tell you we appreciate that very much at Public Health. If you want to put the little, oh, it's already up, okay. So you can go on to the next one if you want. I'm going to kind of run through some kind of what we're doing, where we're going with COVID, and then I'm going to just take questions because I find that lots of people have questions that they don't ask for whatever reason, and I'm happy to answer it. But first, I just have to say a couple of things. One is that 20 years ago, I was talking about how if you have to be in a pandemic, Champaign-Urbana or Champaign County is the place to be for that. Why did I say that? It certainly was not because of CU Public Health. It's because of all of our partnerships. It's because of this community. We have a more caring community. We have people who step up and do the things that are necessary, often without even being asked. And we have a very, educated community. And all of those things have made a huge difference in how we have gotten through not only how we've gotten through this pandemic, but how those in our community who are either new to our community or who are somehow disenfranchised through a variety of reasons have gotten through the pandemic as well. Because our caring in this community extends not just to our immediate friends and neighbors, but to the entire community. And that is key when you're dealing with something like this, because pandemics always shine a bright, bright light on inequity. And we know that there was inequity before, but I don't think that a lot of people realized how significant that would be and how much that compounds the problems of something like an infectious, deadly disease. So I'm just going to show right here, what's going on. I'm going to be looking up at the screen here too, but if you wonder why I'm staring up in the air. So what we've done is, throughout, we've tried to do public information. We try to be transparent and accessible. That has been my goal since the beginning of it. And the only reason I'm allowed to do that is because I have a huge and amazing team behind me at Public Health who is doing all the day-to-day grind, and trust me, it is day-to-day, 7 days a week often of this. We had our planning response. Then we had to sit down and decide what public health services are going to continue throughout the pandemic, because some would have to be curtailed due to the infectiousness of the disease and also because of staffing. So we did that. Then we started testing. Testing didn't come around until around, March, really adequate testing of the first year of 2020. Then we did our contact tracing, and for those of you who don't know what contact tracing is, it's something that public health departments do every day. The idea is to take a communicable disease. Each communicable disease that's reportable has an algorithm that we call people. We try to figure out how they were infected and who else might have been exposed, and then we try to shut it down based on vaccination or testing or isolation or quarantine or things like that. One of the biggest things that really upset me at the very beginning of this had to deal with food insecurity, because we knew that a lot of people were going to be without jobs. We knew a lot of people were going to be isolated in their homes. We knew that a lot of people were going to be too scared to get out and get food. And if there is anything that Champaign-Urbana stepped up and just led wildly with, was food distribution. Restaurants were popping up and helping feed kids who weren't in school. The school started feeding everyone. Churches and religious organizations stepped up. Our food pantry that we have at CU Public Health, I don't even know if people know, it's actually going on right now. It's run by the local Mosque and Islamic Center, and it went from about 80 people a week to 250 people a week, and there was zero interruption in service. No one was ever turned away. The only difference is that we made it a drive-through where we just loaded the food in the back of the car rather than people getting to come in and choose. Next, we had to prioritize vaccination, and this is something that I think we did well in our community. And for those of you who are over 75, you will notice that you were at the very front of the line, and we had special clinics so that people could get in there and get vaccinated without having to deal with the huge crush or trying to, hit refresh 10,000 times on their phone to get an appointment and things like that. Part of what we did for equity is that before I sent those press releases out to the community, we had them translated into Spanish and French, and we sent them out to all of our immigrant cooperative partners. We sent them out to all of our other community partners, and then we sent them out to anyone working with people who were either older, who were low income, basically people who would not have access, or whether it was knowledge or physical access to get the appointments online. And we set up phone systems so people could just call in. And we did it staggered. Probably no one in this room even realizes that we did that. But by the time it hit the paper and you were able to get an appointment, there was already a whole group that had been able to have time to reach out to their clients, basically. So all of our amazing social service agencies in town did that. Then we did the community vaccination, and that's where we are right now. You can see that if you hit that again, you'll see my little arrow pop up there. Maybe it didn't, maybe it won't pop up there, but we're right between community vaccination and assurance. So while we have done vaccination since January in this community, we're still doing vaccination, 200, 300 a day. So luckily, due to the vaccine mandates, people who didn't really want to get vaccinated are being encouraged to do that to maintain their employment. That's going to help. It's helping to get those who are hesitant, because there's only so many people that we can individually convince. The people who believed me when I said go get vaccinated in January and believed the CDC and believed IDPH, they were already vaccinated. Then we got into the whole group that we had to reach out to all kinds of people, all the faith communities, all of social service agencies, all kinds, to help encourage people within their sphere of influence to get vaccinated as well. And then, we'll go on to assurance, and that's where we're constantly checking to make sure that we're doing what we need to be doing. And then we'll do the after-action report, and then we'll start planning for the next pandemic. And in a sense, we're already planning for the next pandemic because I have an ongoing list on my board of things that we had pre-pandemic that need to be changed, and things that we did during the pandemic that we're going to keep. An example is a very simple one. When they closed all of the schools, we knew there was going to be a daycare issue. People had to stay home with their kids. Well, I needed my employees at work doing what they needed to do, so we did a very simple, 100% free and 100% effective change of our policy just by saying, if you have school-age children, you can bring them into work. We have a huge building. They were able to set up their little workstations wherever they wanted to. They were still away from each other, set up their little workstations and do their school work on our Wi-Fi during the day, and it worked out wonderfully. Why we don't do that for snow days and every other kind of thing, don't know, but from now on we will be. And I tried to encourage other businesses to do that as well. Okay, I can go on to the next one. This is just a brief overview of where we are with how this all started. Is the little, is it gonna flip the slide? Looks like it might be stuck. Well, there it is, okay. So a lot of you may not realize, but this actually started January of 2020. A lot of people in our community didn't really hear about it too much until March, and that's when things really started rolling. But we immediately knew the pandemic potential in January. We met with the U of I infectious working group that we're on, talking about the SARS-like illness in Wuhan. We were immediately concerned, and the U of I was on it. Every single person that returned, every student returned from Wuhan went into voluntary isolation because we had no authority at the time to do isolation, and we had no testing. The Chinese community at the U of I prevented us from being one of the places that immediately started an outbreak, and they did it on their own. I mean, they did it with support from us, but they did it, and they went way above and beyond anything that we even knew at the time. What we were working on was assuming that this was like SARS from 2003. Okay, they made plans for the students returning from the area. We started working with EMS and pandemic partners, and then in January we had our first media interviews and press conference. In February, outreach began to all of our community partners and the media. That was where I was showing up at different agencies and organizations and saying, I know you think I'm nuts, but this is coming, so here's what you probably need to start thinking about to get ready for it. In March 20th, we had our first case. Our first case was imported from Italy, so that's where our cases started from, Europe, not China. And the Chinese students doing what they did, and travelers from China, what they did was actually, give us 2 months more of planning in our community that we could have been, started. It could have started right then before we even had access to testing. In March, we opened our public health emergency operations center, which I'll show you a picture of, and we started ordering supplies. One of the supplies that we ordered, we heard that Pfizer was going to be a it would require something called a super freezer, which health departments don't have. I mean, very few places have that. I ordered ours, and then I immediately sent it out to all the administrators in Illinois and said, get these ordered because you're going to need it. Unfortunately, unlike Champaign, where I can just order something like that, a lot of them had county boards and county boards of health who would not let them order anything. Even when money came in from the state to do things, by that time it was too late. And again, that is one of the advantages of us being a public health district and not a public health department. We have a 3-person board, and we can get them together super fast with just 48 hours notice and start moving on things. They immediately granted emergency powers so that I could basically do the spending and then get it ratified at a later date at the next, board meeting. In March, we also started something called non-pharmaceutical interventions. You all know that as closing things down, asking people to stay at home, shelter-in-place orders, things like that. Those started in March, and that's when people were like, hey, what's going on? What is this? And then we didn't do any vaccination until January of 2021 because that's when it first became available. But when it was here, we were ready. I mean, we were ready. And September, this last month, we just started giving boosters. We're still doing boosters. We're still doing dose 1 and 2. Anyone who has had a Pfizer, they've had your first 2 doses. As long as it's been 6 months since your last, you can go in and get a Pfizer dose. Carl's doing them up at Dress Barn. We're doing them out at the iHotel still, albeit in a much smaller area. And every pharmacy has it. So please take advantage of that if you had Pfizer. Okay, I'll flip to the next thing there and just show you. This is our conference room, and this is what it turned into in a matter of weeks. This is not the final photo, but this is on where we do our the contact tracing, because it's basically a big phone operation. Eventually, this had even more cords hanging down from the ceiling, which I'm not even going to pretend like I know what those cords do, but it was just full of cords, and then each one has a plexiglass shield similar to this around each desk, that started. And I always told people, you can do things, and you can do things safely, because during COVID, we did not miss one day of work at Public Health. From the very beginning, we were working sometimes 7 days a week in sometimes conditions like this. But everyone was masked, everyone was distanced, and we did not have an outbreak, although we had at least 15 cases come in. So meaning somebody was infected, they came into work, they didn't know they were infected, and we did not have spread. So it can be done, and it has been done. Okay, next slide. The current stats, I'll show you where we are right now. We're at 114,148 fully vaccinated. That's 62.86% of those 12 and older. It is much higher than that, and I'll tell you why we're having the problem. If you look at the map on our website, you'll see that Champaign and Urbana, 61821 and 61801, the core kind of the cities, it looks like they have very low vaccination rates. They do not. The problem is we have 50,000 students, and they're counted in our census, so they're in our denominator, but tons of them, despite being told, a million times to use your campus address when vaccinated, didn't, including my own children. So they just don't. I don't know what it is, but so we know that that's what it is. Detangling that data, between us and McKinley Health Center takes some time, but rest assured we are much higher. And if you look at our lowest vaccinated zip code in our entire county, which is Penfield, it is higher than most of our surrounding counties' vaccination rate. So, our county has done a really good job of taking vaccine, despite what you might hear. If you can go to that little video, I don't know if you can show that, and if you can't, it's no big deal. But I just wanted to show you a video that is it going to work? Oh, it is. Okay, watch this. You watch the date in the corner, and then you start watching the cases pop up. So here we are in April. Now we're in May, June. This is of 2020. July of 2020. Our worst month was November. That was our October, November of 2020 was our worst month. Okay, there we are in August. September, watch Illinois area. You can see the explosive growth. Again, this was all pre-vaccine. Boom, there's Illinois getting just hammered. Here we are in January, vaccination starts. We're doing great. I'm like, woohoo, woohoo, look at this. January, we're getting everybody vaccinated, we're getting everybody vaccinated, we're getting everybody vaccinated, and, it just keeps moving on. The mutations are happening, but here we go. We're up in June. I'm like, yes, I can postpone my vacation and just take it whenever I want. And here's July. There's August, and boom, Delta variant hits us. When I was planning my vacation, I didn't plan Delta variant into it. So you can see that just, continues. We are now on the down. We are now getting out of that Delta variant. Unfortunately, we are still having deaths. Our first case, I think I already said, was March 15th of 2020. Our first death was in April. April of 2020, we had 6 deaths. Pre-vaccine, when we were in the shelter in place, we had 91 deaths. Post-vaccine, we've had 102 deaths. And I keep reminding people that just because we have a vaccine doesn't mean that everyone was taking it or taking it at the same rate. Then, unfortunately, once we hit August and September, the Delta surge, we had 32 deaths, but unfortunately there were 3 more I had to report today, so we're up to 35 now. We've had a total of around 26,000 some cases. We currently are around 450 when I looked this morning. There are 16 people hospitalized, but Carl and Urbana, again, is a regional health center, which is why we were always so concerned about overwhelming our health system. And then we have 196 deaths now. Champaign County is 3rd lowest death rate in Illinois. That means deaths per 100,000. We're 3rd lowest. Ford County is right at the top of highest. And I wanted to talk real quickly about where we are with equity, because as much outreach as we did in everything that we've done, you'll see that and I keep a track of this on my board every single day to make sure the numbers are going in the right direction. But in the white population is 71.8% of Champaign County, about 66.1% are vaccinated, and they represent 69% of the deaths, so they're below. African American Black, 13.8% of the population, 9.42% of vaccinated, so they're not up there yet, although it steadily has been increasing for the past 2 months. 16% of the deaths, so they're about 2.5% over. Asian population, 10.9% of the community, 12% of the vaccination, which just tells me that they were undercounted in the census, is what that tells me 10 years ago, and 9% of the deaths, so that is under as well. Hispanic Latinx, 6.3% of the population, 5.48% of vaccination, continuing to steadily increase, but 9% of the deaths. So that's about 3% over what we would expect. And the population we're looking at that is 196, so that doesn't include the ones from today. This is what is hard, I think, to grasp. So Champaign County is the 6th highest vaccinated county in Illinois, basically outside of Chicago and Sangamon County. We're neck and neck. Where Illinois is the 25th highly most vaccinated state in the U.S., and the U.S. is more vaccinated than much of the rest of the world. And still, Champaign County at this moment has 95,774 people who are unvaccinated. Some due to age because they're not yet eligible, and some due to I don't know what. I do know what, but that's a whole nother, it's not access. It's not access. Okay, if you want to flip to the next slide, I'm just going to real quick show you that this is just a little slide that it's a World Health Organization slide, but it's something that we always think about in terms of the pandemic response. And you can see that we are headed down. Once you get a vaccine, you should have a rapid decline. But the vaccine needs to have uptake, and it needs to be accessible to all. It's not accessible all over the world, and we have an uptake problem in the U.S., although I will say the vaccine mandates that were implemented for employers are making a difference. Okay, so where are we headed? So we are headed from pandemic to endemic infection, and I thought and don't be insulted if you already know these these words, but I speak to a lot of different groups, but I always like to make sure that we're all clear on what this means. This is something irritating that happens. I don't know how to fix it. When my phone rings, it rings on my watch. I don't even know how that happens. It's a Fitbit. Anyway, so pandemic means a worldwide spread. So AIDS was a a pandemic. H1N1 was a pandemic. It doesn't say anything about the virulence of it. It says about the worldwide, spread. And then, of course, the novel coronavirus. We're getting ready to go into it being endemic, meaning that it is a disease that's just going to be found in the population. So, but luckily it's a vaccine-preventable disease, so we'll be able to, treat it more like flu eventually. What are we going to have with that are epidemics, or what we often refer to, public health often calls them outbreaks, but that means we're having an epidemic of something, and that can be a widespread occurrence of an infectious disease in a community. So sometimes we have an outbreak of salmonella, or we have an outbreak of anything. Our flu numbers are above baseline. They're above what we would expect. So that means that we're having an epidemic. And then we think, but we don't really know for sure, but it could be that because COVID is a respiratory virus, that it could become a seasonal epidemic, like flu is. Flu is every year seasonal epidemic. RSV, we have norovirus, we have all these different things that come around seasonally. You can get them anytime, technically, but you're more likely to get them during that time. So how soon will COVID become endemic? Short answer, I don't know. But I will tell you that vaccination rates continue to increase slowly. Public health, it's like always our big dream when you have anything like this is to get a vaccine. We wanted one so bad with HIV/AIDS, and of course that was never to come. But it gives you something to do, and you're able to move forward, and you're able to start bringing this down. What we did not ever plan for in any of our planning anywhere in the United States was fighting against our own government's disinformation. That we never planned on. We never planned on entire news channels giving false information. We simply didn't plan for that, and it's very, very difficult to combat. We will reach some type of herd immunity. Infection will lead to a lot of morbidity and mortality, so we are going to eventually get to where it'll be endemic. And you all have been vaccinated, so you're helping that way. People who want to roll the dice and risk infection, unfortunately, a lot of them are dying. So that is not the way to do it. But they are, in a sense, becoming part of the vaccinated. They're just vaccinating with a risk of either death or long-term, you might have heard of COVID long hauler syndrome. We also don't know what the COVID may do in the future. It used to be that people would get hepatitis C, be sick, get over it, think that they were done with it, and be done. Now, of course, we know that that leads to liver cancer. We know that infection with HPV leads to all kinds of cancers, oral cancer, penile cancer, cervical cancer, all kinds of things. So we really don't know where this is going way down the road, but you don't want to take that chance. Okay, now, this is the fun part. What keeps me awake at night? The main thing is that we get a mutation that spreads rapidly like the Delta did, but it is not it's not stopped by the vaccine. Now, this worries me a little less than it could, only because the vaccine architecture is there, so they'll just have to put in the new variant or the new, whatever happens to blow past the vaccine. But it means we have to start the vaccination campaign and the non-pharmaceutical interventions again. So that is concerning. And again, what I had hoped would happen is that we would get the vaccine in the US, we get everybody vaccinated, boom, we're off deploying to other places to get our vaccine and stuff out to other parts of the world to make sure that everybody's getting vaccinated. That did not happen. Another pandemic in the near future, that keeps me up sometimes. And yes, it could happen. I mean, I could go back in an hour and there could be another disease pop up. I follow something all the time called CIDRAP out of University of Minnesota, and they're always looking at different, well, of course, the World Health Organization, CDC is too, but they're always looking for what is emerging in other areas, and do they have pandemic potential? Another thing that very much concerns me is the eroding of public health funding and regulatory authority. Look at what's going on in Texas. That's not just going to affect Texas, that would affect everyone. They're talking about doing away with school vaccination mandates for tetanus, diphtheria, measles, mumps, rubella. This would be disastrous. I also am concerned that our country will not have learned the lessons that are important from COVID, that inequalities before a pandemic are amplified during the pandemic. We need to start addressing those much harder and now. Prevention and population health is not prioritized. In the US, we have a fascination with medical treatment of all kinds, whether it's drugs or devices or whatever, when prevention, you know the old adage, ounce of prevention is worth a pound of cure. That is absolutely true, not only in cost, but in suffering. And then I am also extremely concerned that this epidemic of disinformation and disease and division will continue to spread to other areas. So that too, concerns me. So what can you do? You've already been doing it since the beginning. Mask and vax. Get vaccinated, mask, wash your hands. And when I say get vaxxed, it's flu season, so go get your flu shot too if you haven't done that yet. And if you haven't had it, you can have the booster and the flu shot at the same day. It doesn't matter. You don't need to, but you can. At the beginning, you may recall that we were like wanting you to wait 14 days between, the reason why is because they hadn't yet been able to study that, because the vaccines were so new. Now they know it's fine. Okay, and now is the time where I just stand up here and you guys can ask me any questions that you have. Yes?
On the third shot, for people who had the 2 Moderna shots, I'm confused about whether the third shot is a new dose developed, or is it the same thing as the first shot?
Okay, well, so far only Pfizer has a booster dose, and it's only for people who have had Pfizer. And it is it's the same dose, it's the same thing. Moderna is working on something that they're doing kind of like a parallel thing. One, they're looking at the new, just doing a regular dose, and will that be effective? Luckily, that hasn't been needed yet. Pfizer is showing waning immunity, Moderna not so much yet. And why? Who knows? It could be that there was just an extra week between doses, But Moderna is also working on one where they are tweaking it a bit, what is going to be in the booster dose, to try to address some of the things where they know mutations are happening. So we don't know yet, but if it gets through FDA and then something called ACIP and then the CDC recommend it, it'll be all over the place. But the Pfizer dose is just the exact same dose. Yes, you actually, only people that have had Pfizer doses are eligible for the Pfizer booster. If you've had Moderna, just wait, or Johnson & Johnson, just wait until those boosters come out. Yes?
Yeah.
Whoops. Thank you. Of the 95,000 who are non-vaccinated, are they identifiable by geography, by age, by socioeconomic class? And are you making headways in vaccination among all of those groups or only among some of them?
We actually are. And I should, again, that 95,000, I have to use the numbers I'm given. That does not account for the U of I stuff. But so a lot of them are kids who are not eligible, and we're already up to about 65% of 12 to 17-year-olds. So this is parents that have to sign off on their kids getting them. So as soon as the 5 to 11-year-olds vaccine is available, which they just applied today for that, it looks like we should expect at least that same rough rate. So, but yes, what is making a difference is all kinds of things. There are employers who are offering incentives, $500, to staff. Public health just made it mandatory. If you work at public health, you're going to be COVID vaccinated, end of story. There are the OSHA mandates that came out now, so we are starting to see those numbers increasing. And the good thing about our county is people have been super good about wearing masks out in public. If you look at our county, if you go to another county around us or have during all the pandemic, it's just like, where am I? You know, do they not have a pandemic here? But I do want to tell you an example. I just talked to a colleague that lives in Lubbock, Texas. Lubbock, Texas County is about, they have about 40,000 more roughly people than our county does. I was talking that we had 193, this was the other day, 193 deaths in our county. And she said, really? And I said, why? How many do you have? 964. Now that is simply vaccination and following procedures. And it's all voluntary, and this community has done it because they're just not doing it there. So, and that's just one example. There are examples like this all over, and that's why you see that we're up over 700,000 Americans dead from this. Many, many, many of them after the availability of the vaccine. It's very, very troubling. But she said down there, they just act like that's normal. I said, well, I can assure you it's not normal. It's very much not normal. 964. And I don't even know if they've been hit yet with the Delta, because you noticed by seeing that map that it pops up in different parts of the country. It's not just everybody at once and then everybody's better, and you know, it moves all over in waves. Does anybody? Yes?
I could just shout.
Well,
I can hear you.
It's better for our at-home people.
Oh, yeah, there are people watching.
Oh, okay. For those out there. I understand there are some hurdles with contact tracing, and I wondered if you could address that. A shortage of tracers and schools and things that aren't doing it, that kind of thing.
Well, again, that's not in Champaign County, but yes, it is a problem everywhere. The contact tracers it's not a fun job. You know, you're calling people, and depending on where you are, people are not always nice. In fact, sometimes they're overtly hostile, and sometimes they're threatening. We had a little bit of that, but nothing like what my colleagues in other counties have experienced. So contact tracers it is something that you can be trained to do. It's very computer heavy. It's lots and lots of computer work and phone work, and it's you know, I would find it extremely difficult to do that for 8-10 hours a day, but they do it, and they have done it through the beginning. We went from 120 at the start of the pandemic to 200 employees. That's how, you know, of course, we're in a university town, so we didn't have the difficulty getting contact tracers that some did. And our schools have been amazing partners. You know, there was some arguing early on about when we were talking about going back and masks were going to be required and all that, but they still do it. They follow the guidance, and it makes all the difference, and you can see that. We have some schools that have very high vaccination rates, and some communities, rural communities. If you look at Mahomet and Fisher, they are very highly vaccinated in those communities, which is great. So all of that helps. Mm-hmm. And by the way, if Joan and Shirley are watching the podcast from Clark Lindsay, hey.
I'm a member of the hospital visitation team here at church. None of us are ready to go back yet, even though Carl says we can come. Mm-hmm. And we were wondering if you could give us possibly some sort of a metric where we could think about going back again. I mean, Carl says it's safe, but we know they're having an influx of patients now. So is there some number that we should be looking at, or
well,
what?
I can tell you, of course, visiting a hospital is a whole different thing because they're regional hospitals. We know that our numbers are going down. I don't know who you'll be visiting. Is this in non-COVID rooms, I'm assuming? So, yeah. I mean, so it's safe to, there are a lot of things that it's safe to do now. As long as you're vaccinated and you're masked, a lot of things we can go back to normal doing. You know, if you visit somebody in the hospital, ask that they put on a mask as well. even though they might not, be used to doing that. And just keep your distance. But there's no specific metric because it's just ever changing, and I wouldn't want to just give one. But I will tell people that as long, and this is going to be throughout the rest of the pandemic. Once you're vaccinated and you are masked, you can do a lot of things, because it is safer. And again, everybody's like, oh, the masks don't keep things, they don't keep viruses out. Well, they're not designed to keep viruses out. Masks are designed to keep your own breath close to your body so that it's not spewing out. If I were standing here and it was really cold, like I was outside talking, you would see a plume shoot out of my mouth just from talking. Then if I coughed or I sang or I did something, you would see it go even further. So the masks, if you go out there when it gets cold, maybe I'll do that. I'll do a little video on that. But when you go out there and it's cold, your mask, it stays close to your face. And that prevents your breath from going to somebody else, but if their mask as well, it keeps theirs from coming to you. So that's the idea behind masks. The things that keep the viruses out are what we wear when we do deal with various things, TB or home visits with TB, things like that. And those are respirators, and those are required to be effective. You have to be fit tested, and that's a whole thing. But in this scenario, what we have is working. I do want to caution everyone that flu is going to be circulating this year. It wasn't last year for a variety of reasons. It will be circulating this year. We've actually already had a couple of kid cases, so the masks will help with that as well, and the distancing and everything. But so will the flu shot. Okay.
You mentioned food insecurity as one of the results of the pandemic, and I was amazed about what you said about the things that our community has been doing to help with that and help with other problems that have become worse. Are there still issues that need to be addressed, and is there a lack of help for certain communities or
Yeah. Well, one of the things that is getting ready to be a problem is the eviction moratorium has stopped. That is going to make everything worse. I mean, if you're struggling with having a home, obviously, you're not going to be able to worry about everything else. So that's going to be a problem. We lack safe and affordable housing in our community. And that's going to continue to be a problem. And again, during periods of stress like this, that will be made worse. So that's always one. The families that are going to be getting evicted is going to be a problem. And again, our community has worked on these issues a lot, but we're still going to be in for some pain before we can get out of that. There's been a lot of issues with people just the whole mental health aspect of it as well. It's very, as you all know, it's very isolating. It's very frustrating. It's sad. We've had loss in our community. And by the way, if we have I don't know if you know this, but at one point the Unitarian Church put together a memorial called Open Hearts, and it has a heart representing each death from COVID in our community. It was at the Unitarian Church, then it was at the Mennonite Church, then it was at McKinley Presbyterian, and now it's in front of Public Health. And if you want to see it, you can go by there. People who want their family's name on it can submit that to the memorial through the churches, and then they'll tell me, and I'll get their names on there. Otherwise, it's just a heart for each one. Because when you have something like this, there does need to be grieving. When you have a disease like this, there is stigma associated with it. I don't ever exactly know how that happens, but there always is. So people aren't talking about it a lot. If they have somebody in their family or friend who dies, it's like there's a shame thing built into that, which is unfortunate, but it does become a part of that. So, we need places to acknowledge that we are having deaths. We're doing a great job in our community, but we're still having deaths. And every one of those deaths, it's not like just 196 people. Those 196 people have family and friends and colleagues and, and so it's very deep. I don't know anyone who does not know someone who has been affected by COVID. Anybody have any other questions? Yes, there's one back there.
One more.
I was looking at my, if I need to get down on here, you just tell me to shoo, because I do a lot of this, so you just say, get off of there.
I was really interested in the things that you said about the Chinese students quarantining on their own, the voluntary and so forth. And this is the first I'd heard about that. And I was wondering if there's any way that more of that information can go out, like in the newspaper or so forth, because I come from Georgia, and I was very aware of the attack on the Asian women down there, and it just made me so sad. And I just think that this taking it out on, I mean, maybe this would help if people knew their positive response.
Yeah, and it's always iffy, because there are people who are xenophobic and are just hateful and are always looking for somebody to scapegoat, always looking for somebody to scapegoat. We had it with HIV/AIDS, and we had it with this. But yes, I cannot tell you how amazing the university was working, and the students working together, and not just students. It was also, probably some faculty and some staff as well, but they knew exactly who was coming in. We had a better handle on who was coming into our community than any place else, because every place else was worried, they were dealing with like the quarantine station at O'Hare. Our students and stuff were absolutely identifying themselves and making sure, and they were isolating on their own. And the Chinese organization in our community, I can't think what it's called right now, but they canceled their Chinese New Year celebration on their own. And we at Public Health said, you don't need to do that. That's not, that's not necessary. You don't need to do that. And they said, well, we're going to do it out of an abundance of caution. And I am every day grateful for that, because they knew, and they knew what potentially could happen, because there have been other emerging diseases that have popped up there, and you often see people in Asian countries wearing masks as a regular thing, and it's we never really knew why that was. A lot of it has to do with pollution, but also a lot of it has to do with being very close to people. And anytime you're very close to people, you're going to be exposed to whatever they're carrying, whether it's a cold, whether it's TB, whether it's whatever. You're breathing in their breath, you're going to be breathing that in. So they had the jump on us, but they did do an absolutely outstanding job, and the U of I. I do like to think back to after we got past the incubation period of everybody that had returned from China, and somebody at the table at one of our meetings said, "Whew, I'm glad that's over." And I was like, "Oh." And then I looked at my colleague, my epidemiologist, the deputy director, and I said, "Some people don't know where we're headed." So I'm like, do we tell them now, or do we wait? But yes, we did avert that very early outbreak, and at the beginning we had no tools, right? Because that's how it happens when you have something new like this. You only have very, very limited tools. And the important thing for public health is when there's a test developed, because the test is what we can then use to trigger isolation or quarantine or the other measures. Without that, we don't do that. So the test was very limited. And we know for a fact that we had some students who were sick with this, but we had nothing we really technically could have done, but they did it on their own. They did it on their own. And they prevented us from being the first little spot on that map swirling up. But like I said, ours came from travel, people traveling. People were still traveling to Europe, and even though Italy was having a horrible outbreak, and so were some other countries, but people were traveling, and that's how it started locally. Lots of travelers, not just one, but.
Your comments were a good lead-in to my question. With sporting events, musical events, all kinds of events taking place now with large groups of people, some indoor, some outdoor. What kind of guidance would you give us if we wanted to attend these, or should we not attend them?
So we have, some kind of general guidance out there, but if you're vaccinated and you're masked, you are, basically able to do things outside with no problem at all. If you can do it where you distance, it's even better, especially, indoors. We have seen multiple football games, and knock wood, we have not seen any outbreaks associated with that. Now, could there have been an outbreak in some part of the state where people were not highly vaccinated? Absolutely. But was it that, or was it them all traveling down in the car together or going out to dinner afterwards? So, it's hard to say. We have seen breakthrough cases, but I want people to understand that most of the breakthrough cases that we've seen are because some of them have symptoms, but a lot of them are really mild illness, but some of them are only caught up because they were part of an outbreak investigation. So, if you're vaccinated but your kid isn't, and your kid comes home from school and they're positive, you're gonna have to be tested too, and you may be perfectly fine feeling, but you could still spread it. So that's how we've caught some of those, breakthrough infections. And they're to be expected because the vaccine is not 100% safe. So I can't give some, general statement like, you can do this safely, but there are things that we call it in schools the Swiss cheese method of prevention. So the more things that you can layer on top of each other, the better, because none of them are perfect. So you got the vaccination, that's the main one. Then you've got masking when you're around others. Then you've got, distancing, and you've got, hand washing and all those type of things. Although hand washing, and we certainly encourage that, it hasn't been, the big thing that we were at the beginning concerned about. Because you may recall at the beginning we were worried about it being on surfaces and being able to easily be transmitted. And while it theoretically can be, that's not where the spread was coming from. So, but at the beginning, all the guidance comes from what is the closest thing we've dealt with that's like this, and then you have to do that. You have to err on the side of caution and put out the biggest bunch of protections you can, and then as you learn things, as science starts showing you this is not the case with this, then you can start peeling those back. Mm-hmm. Yeah.
I'm wondering what your thoughts are on global vaccine access and equity, and what the United States can and should do to address those gaps.
Well, I mean, what I think that we should be doing is, what I would have liked to have seen is by summer, all of our country would be vaccinated, and we would be deploying our resources, whether that's staff and vaccines or whatever, to other countries and helping bolster their vaccine efforts. Because a mutation is going to arise from wherever it's spreading the most, So it has the potential to spin off another, one that's more concerning, another variant. But we need to do that. I mean, I can't stress enough that we are one world. We are one health. Animal health, human health, and environmental health are absolutely linked. And they're not just linked here, it's linked around the world. So that's where we're seeing a lot of viruses emerge, from different types of interactions with animals, be it people need to eat bush meat in Africa to survive because of, population, or because of deforestation and animals coming in because they have to survive. All of these things are connected. And if you want to read a really interesting book, there's one by Nathan Wolfe out there. We had him here to speak a few years ago, and he actually goes out into different parts of the world and works with people to collect samples to try to get a jump on what is the next AIDS or Ebola or something like that.
I'm wondering if public health has any comment or has seen research about the mental health of young children who are not eligible to be vaccinated, may be attending school, even though they are masked, with many students who are not masked, and they're very worried about themselves. Do you know what's happening in that area?
What we hear about from the schools is because we work with the different individual schools, and sometimes we'll hear something like that. I will tell you that any of the little kids that I've been around, they simply don't care about the masks. They put them on, they wear them, might as well be a pair of socks. I had two of my little great nieces up at the Art Institute when we were at our low period this summer, and they wore those things for all the entire day, including playing outside between the museums, and they simply didn't care. So there's that, but there is also this whole division where people are saying, you're taking away our rights by doing this, or it's somehow you're going to breathe in your own breath and harm yourself. So there's, a lot of that. But mental health in general, I would say, is not good. Not just among, just across the board. We are at a more anxious period. I think we're at a more, depressed period. And we'll come out of that too, but it's a painful period. And some of this is we're not even gonna know a lot of this until the end when the pandemic's long over and everybody has a chance to really crunch all the different statistics that are out there. I do know that locally, we were concerned, and we did look at our suicide statistics, and our county was not above normal in that. I do think that we're going to see increases in substance use disorder. I think that we're going to see relapses. I think we're going to see, people using substances more than normal for whatever reason. And there will be other things, that we will see. But the best thing for that is to have a supportive community and to reach out to people, and that's just a lot easier for some people than for others. But does anybody else have any questions to keep me in here while it's pouring?
I just have a quick question about, after hearing all this, the situations in our county, in our community, and I was just wondering, is there anything, standing from where you are and what you have seen in this past year and a half, what our church community can do to help?
Well, the faith-based community across the board in our county has been amazing. I have met with the Interfaith Alliance multiple times. I've met with, I talked to faith leaders when they call me, whether it's about can we do this safely, to how do we do outreach to the sick in our congregation. And what I tell everybody is to, number one, look out for your own congregation. Reach out to them, find out how they're doing. However you do that in your congregation, whether it's emails or phone calls, or check on people, see how they're doing, see how they're feeling. Not just are they sick, do they need a ride to that? Do they need help getting groceries in? And I wish I could have seen it. I mean, I heard bits and pieces of it, but sometimes I feel like I'm like flying over and looking at our county, and it's so impressive because there are so many things going on, and there are so many people looking out for others. And so if you have someone that you are in your sphere of influence, which was what I always say, but reach out to them, make sure that they are getting their questions answered if they're vaccine hesitant, because they need to get vaccinated. Make sure that they have enough food, because people aren't going to say that, or maybe they just need to, somebody to talk to. So, and that's what I think our faith communities in our county have just done an amazing job with. And they've also reached out and helped through some of the other programs that we have, like, I don't know if you're aware of it, but like at Champaign-Urbana Public Health District, we have something called the Immigrant Cooperative. That's on the East Wing, and it has the Refugee Center, it has Immigrant Services of Champaign, and they've been doing all kinds of stuff throughout this pandemic, all kinds of stuff. And then we have the Y on campus the New American Welcome Center, and all these different agencies and groups have been making sure that that they're taking everything that public health does and they're making sure that it's getting out to their sphere of influence in any way it needs to be done. Early on, a lot of what we were doing for people from Guatemala, for example, was somebody would come in and that spoke Conabal, and I would say whatever I was going to say. They would bring me questions. I would say it. He would translate it into little video clips or audio clips that were then sent out through phones and things. So we don't care how to get the message out, and we don't know every way to do it. What we need is people to tell us, we need this information, and this is how to get it out. And there are just so many stories to tell, so many stories. You know, there could be books written just on the U of I's response, just on townships' response, just on the city leaders' response. Because I don't know if you are aware of this, but, you know, at CUPHD, we have had support from the university, we have had support from the mayors of Champaign and Urbana, the county government. We've had, you know, since day one, the schools, faith-based communities. Since day one, we are communicating with each other almost every single day of this entire pandemic. And to have us all moving forward in the same direction, pulling on the rope in the same direction, if you will, has been, is something that you can't even put a price tag on that, because it has just been amazing. Do we take a lot of flack from people? Yes. But that's okay, because people are frustrated and scared, and everybody has their own issues. But, you know, the mayors and I say, we're big girls, we can handle that. I mean, would I rather not have it? Yes, but we can handle that, because we know we're doing what is right. And what I've said since day one of this is, at the end of the day, I have to be able to sleep at night. I have to know that I have done every single thing I can. And I will feel like that. I try to, you know, there are days where I don't, but I feel like that because of the collaboration, because of the stuff that was put in ahead of time, and this amazing community. I feel like we are doing everything possible that we can. I was actually delusional at the very beginning in March and thought, I think our county could get through without any deaths. So, you know, every single death is like a gut punch, especially after vaccination. It is really, really hard. But we will, you know, this will at some point, like I said, it won't exactly end, but it sort of will end. It will become endemic, and it will be something else that we deal with like we deal with flu. And the fact that all of you are sitting here on this horribly rainy day in masks, listening to me, is just showing you how wonderful our community is, asking what you can do. I mean, how much better can it get than that?
Thank you so much.
Thank you.
Well, I don't know about you, but I feel a lot more hopeful about our situation and our town. And I've always been really positive about this place that we live, and especially this community. But Julie, your words are just telling us what's been going on, and it's really uplifting and hopeful. I'm very hopeful, and not all days are like that. So we really appreciate it. Thank you so much. At this time, we're going to have Diane Mortensen come up and dedicate our lease coin offering. Carol Pinka couldn't be here today, so Diane will be taking her place.
I think you can hear me best if I do this. Carol has been our treasurer for some time, and she does a marvelous job. And because she's not able to come today, I said, Carol, let someone else do it. And she said, okay. So I'd like to tell you a little bit about the Fellowship of the Least Coin. It is a global ecumenical prayer movement that was begun in 1956 by Shanti Solomon from India. She believed that women anywhere could have a sense of being part of a worldwide family of faith, and her vision is now a reality. And it is that through this that connectedness would arise from women praying for peace and reconciliation, and that setting aside the least coin of their country would be a symbol of that prayer. So as we have collected coins through the year, even in the year of pandemic, Carol said, yes, we have still been able to do that in a different way. So we want to dedicate that offering today. And we think about how that is a sign of the oneness we have in common with others in the world in our quest for peace, justice, and reconciliation. So on the board, I think there would be a prayer that we can pray together. Yes. So I think you can read that. So let us pray. O loving Creator, we present ourselves in your divine presence to thank you for all the beautiful gifts of life. We are especially grateful for the fellowship of the least coin, which binds us together in love and forgiveness around the world. Free us from all doubts and prejudices, we pray. Inspire us to love in solidarity with humankind, that we may know the joy of giving and receiving. Dear God, accept the least coin, token of love. Make us mindful of the miracles of these coins. Let us honor your creation with love, as shown through the life and resurrection of your Son, Jesus the Christ. Amen.
I was just checking my app to see what is going to happen with this rain. So it says rain pretty hard for the next 15 to 20 minutes. So, and then it's going to let up a little. So if it's possible and we try to socially distance, maybe we can hang out a little bit downstairs and chat with our masks on, of course, and not digging into your goodies until you leave. Well, normal or not, I'm so thankful for our gathering here today and for each one of you. It's so good to see your eyes, at least, see our faces. Whether you're watching at home or here in person, we're thankful for you today, and we're better because of being here. We're better together. Thank you to our wonderful speaker, Julie Pryde. Your job has really put you in the spotlight this year. You're kind of like, I don't know, a celebrity. Like, it's like seeing, I don't know, Brad Pitt or something here. And we just are so appreciative that you took the time out of your busy schedule to be here. Whenever I mention this to anybody this week, they're just like, wow, Julie is coming here? She's so busy. I'm like, I know. So we're very, very appreciative, yes. So don't forget to get your goodie bag before you leave. And before we go, if you could all stand and we will say our mitzvah benediction together. For those of you who aren't normally with us, this is what we do before we leave a gathering with one another. And this is at the bottom. It's at the bottom of our program today. May the Lord watch between me and thee while we are absent one from the other. Thank you all for coming today.